Welcome to the Live Healthy Miami's Gardens Facebook Live weekly health and wellness series brought to you by the City of Miami Gardens, Live Healthy Miami Gardens, where we bring you and your family information and resources to help our Miami Gardens community make the healthiest choices possible for ourselves and families. My name is Katia Harris. I serve as Breastfeeding Touchpoint Program Manager at Jessie Trice Community Health System, a member of Live Healthy Miami Gardens, and your host for today's Breastfeeding Masterclass. Live Healthy was born from the realization that although health is largely influenced by our individual choices, the conditions in the communities where we live, learn, work, worship, and play also play major contributing factors to the racial and ethnic health disparities faced, as well as our overall ability to make these healthier choices. We know that these conditions are systemic, historical, and continue to impact us as communities of color and as a whole here and now. Live Healthy Miami Gardens is a community initiative and part of the city's efforts to address these conditions and reduce poor health outcomes through the transformation of policies, our environment, and the healthcare system overall, making the city of Miami Gardens a healthier place to be. Today, we're going to learn about an adjacent topic, Our Village. It's the name of a new program of Jessie Trice Community Health System. Joining us today to talk about it is Dr. Timothy Tyler, Outpatient Director of Behavioral Health Services at Jessie Trice Community Health System, adjunct faculty at Barry University, and founder of a nonprofit organization called the Miami Globetrotters that take underprivileged young people to Africa on educational excursions. He is also the son of missionary parents who worked in Africa and is a missionary himself, having completed mission work in West and South Africa, in Belize, and in Haiti. Dr. Tyler has over 40 years of bringing meaningful change to organizations and enriching the lives of people. He's also my colleague, co-worker, soon-to-be supervisor, Dr. Tyler, aka Tim. Thank you for joining us today.
Thank you. It's good to be here. Thank you for having me.
Can you tell us some background on Jessie Trice and a little background about Jessie Trice Community Health System, your experience with Jessie Trice, and the behavioral health services provided?
Sure. So I worked with Jessie Trice before I worked for Jessie Trice. The first introduction to Jessie Trice was when I was working for Health Choice Network, overseeing contracts through the Children's Trust. Jessie Trice was one of the first FQHCs in the country, certainly the first one in Florida. And basically, it was set up to provide services in areas that did not have access to healthcare. So for us, Jessie Trice was set up in a historically Black community, Liberty City area, but it's expanded to Miami Gardens, Opelika, Hialeah. So it spread a lot since it's been there, but it's still doing the same work, which is following the mission, which is serving uninsured and underinsured patients in Miami to make sure that everybody gets quality health care. On the behavioral health side, that continues to grow as our culture continues to change. The need for behavioral health continues to increase, but we provide this under the same umbrella. We provide health services to people who are uninsured, underinsured, or Medicaid. And we also provide to private insurance as well. So we're not limited to who we provide for, but we're set up as like to keep people from falling through the cracks if they need care and don't have access to it. So our behavioral health includes psychiatry, counseling, medication-assisted therapy. We have therapists in schools. We have therapists in the community. So we're really out trying to do the work and make sure we're providing good care.
Awesome. And how does pregnant families or breastfeeding families fit into that model in receiving behavior support and the resources provided by Jessie Trice?
So it's a great question. We have what's called an integrated model, which means that we provide a lot of services under the umbrella of Jessie Trice. So we provide services to moms, we provide services to children, we provide services to people in the community. And inside of our organization, we have the ability to refer. So in other words, if a doctor has a patient that just had a child and they see they're going through some type of depression, they can do an internal referral to behavioral health to make sure we can follow up on that. So it's really set up as an integrated way to make sure that anybody, once they touch Jessie Trice in one part, they're connected to Jessie Trice in all parts.
Okay. And what are those other parts? I know obviously we're talking about the behavioral health component, but what are some of the other services or programs that Jesse Trice offer, whether for the pregnant and breastfeeding families or just families in general or
So,
individuals in general?
yeah, so we have oral health programs that provide dental care. We have great dentists, probably one of the top programs in the state. We bring interns in. It's a teaching part of Jessie Trice. So dental is there, which, believe it or not, is actually hard to get access to private dentists. So we have availability for great dental care. We do primary care, which covers a lot, but we provide services to elderly, we provide services to pediatrics. There's almost no part of primary care that we don't provide services to. We also have optometry, right? So we're there for your eyes, for glasses, things that you wouldn't think about. In addition to all of those services, we also have a pharmacy now. We have a pharmacy in 3 locations. There's a pharmacy in Miami Gardens. There's a pharmacy at our corporate facility, which is really for our main unit. And we have a pharmacy, I think, at Flamingo as well. So we're really trying to put everything like in one place under one roof to make it easy for people to get services.
So while you're getting your healthcare taken care of or receiving healthcare services, you can also pick up the prescription
Yes.
in one-stop shop and go home.
Yes. And the pharmacy
Awesome.
is relatively new. So a lot of people are not familiar with the pharmacy, but the pharmacy has been up now for 6 months, maybe longer. And we also have the ability to deliver the prescriptions to your home if that's needed.
Awesome. Thank you for sharing that. So I know you mentioned that, of course, JC tries to take insurance. What about those who, especially in our underserved and under-resourced communities, how does Jesse Trice assist with families who don't have insurance?
So we never turn anybody down that needs help. That's number one. And that should be said 1,000 times. So if you need help and you don't have any money, or you don't have access to the funds at the time, we don't turn anybody down for care. We do have what's called a sliding scale. So it's based on your income, and that's all individualized. But we don't turn anybody down. So if you don't have insurance, come, right? We'll figure out a way to get you in, to get you seen. We're not going to make the burden of the cost of healthcare a reason why you can't receive it, which is unfortunately kind of common in our country today. So we try to alleviate that, but there is a part of disclosure, financial disclosure, and we'll put you on a sliding scale, and we'll take it from there.
Okay. So now our village, New Jesse Trice program. What is our village and why that name?
Okay, so um, again, good questions. So what we looked at, we saw, the whole concept of it takes a village to raise a child. So what is the village, right? And I think we're losing understanding of what village was because we're being dispersed and neighborhoods are being gentrified and things are happening that are destroying the core, right? So the village means every part around. The village would include, of course, healthcare, but the village also includes community organizations, it includes
Hmm.
churches, support systems, right? So the village is the whole, right? So when we say our village, we're saying who are we as a community, right? So we're a whole because we can't do it on our own. You can't do it on your own. So the village approach was, okay, let's disperse this responsibility, right? So let's spread this around. Let's get people to work together with the common goal and bring back the concept that we are better as we work together.
Awesome. And who is this program for? And
All
is
right,
it just
so
for, oh, go ahead. I'm sorry.
yeah. So the program, it's a the concept is that we provide parenting services, um, and it was specifically our section of that was designated to identify women that were pregnant or had children under 2 years old, to take care of that window. And the goal of that was how do we make stronger parents? How do we empower parents? How do we connect parents to services? And how do we build a community inside of all that so that even if they're not with us, they have additional support systems. So our section of this whole initiative was to target, again, parents that were pregnant or had children under 2 years old.
Okay. And is this just for families in the Miami Gardens area, if at all, or is this extending to Miami-Dade County as a whole? Does it extend to Broward County, or who can take part in this program?
So part of our structure was that we would want to support them with the so the target area would be from Ohio Miami Gardens. That way we have clinics that we can tie them into. We have support systems that kind of built into place around that. But we also have other components of it. So we may be able to do like an online component. They were out of the area and we can pull them into that. But part of this goal is that we'd be supportive of that need. So if that need came up outside of our immediate area, we'd try to find a way to meet that. But we're really targeting around our centers so that we can tie in the ability to get them the integrated care that we spoke about earlier.
Okay. And my understanding is that not my understanding, our village is a parent and family strengthening program, and it is a partnership with the Children's Trust, who focus our programs, obviously like these. As far as the need for this program through the Children's Trust at Jessie Trice, what have you observed in your experience as the need for a program like this?
So part of that is, and again, really good question. So part of this is before they put all this together, they looked at data as always. So they would look at data, for instance, on how much DCF involvement is going on in communities, how are kids doing in school, how are, what are the needs that parents are saying they want help with, right? So you have to look at all these types of issues. So obviously in our community, there's always a need for education. People are very involved in working and surviving and taking care of kids. So when do you go sign up for a class? When do you have time to do that, right? When do you have, set aside time to say, okay, I'm going to work on this, and then you have to go find that thing. So I think part of it is we're meeting the need that's out there that's been evidenced by data, and we're saying we're going to make it easy, right? You're going to come, we're going to do the class, we're going to make sure that you eat, we're going to look after your kids, we're going to help connect with other services that you're going to need. So we are trying to make the process of obtaining education easier. And the trust saw that, and they wanted to do it, across the community, across Dade County, but they also targeted, right? So our job was parents that were pregnant, to other target areas for other families, but this is the one that we're focusing on.
Okay. And then you spoke about the our village also including the involvement of the of organizations, not only Jessie Trice is the organization, but organizations outside of Jessie Trice. What is the role that you like to see providers and community partners have within this project in serving our families?
Right. So one thing, we have our department, right, in Jessie Trice, and we work with the young kids, we work with the pregnant parents. So we have a small group of people that we know are in need of our services. There's a much broader group of people who are coming in contact with other organizations that we don't know. And so how do we contact them? How do they contact us? So our hope is that we would put the word out to organizations that are working with families already, and that this would be in addition to the services they provide. So we would become a referral source for them. And this is across the board, right? So this could be community organizations, this could be athletics, right? This could be churches. If you're coming in contact with parents that need assistance, then we want to be able to come in contact with you. So we're throwing a very, very wide net out there to let everybody know that these services are available.
Okay. And what role would you like the families to take in this project for their own benefit, or what outcomes are you anticipating the families have as being part of our village?
Right. So we already got a call, right? So from all of our flyers out there, I got a call today. And the mom wanted to know, she's like, I have a young child. I'm a single parent. I get frustrated sometimes. Can y'all help? Right. There's some services that I need. So I think what we find is that a lot of people live in isolation. So I'm hoping that the parents are going to want information. They're going to want a supportive community. They're going to want the connection to services. So I think the need is there. It's letting people know that we're able to fill that need, and also kind of making it a safe place, right? Sometimes people think that if they're not doing well, that we're gonna be the ones who call on them and say, hey, you know what, you're not doing good. That could lead to something
Mm.
bad. So we're trying to avoid that and make sure that we're setting up a safe community.
Now, this program sounds great. We already got a call. Um, so that means we're already accepting families now into the program. When does the program begin?
So yeah, and you can help me with this a little bit.
Okay.
So
Or
we're
just,
already,
okay, I guess a
yeah.
clarifying question. Like, is it because for it to be accepting people now, I know it's the program starting soon, close to October, but is it the one time uh are we accepting families in one bunch one time, or is it throughout the
Okay.
year?
All right. So we're going to set up different cohorts. We have our first cohort rollout. We're already accepting applications for that, and we're going to do at least, I think we say 4 cohorts a year. Um, the plan is that we would have an available cohort in different parts of the city all the time. So there'll be something available year round in some part of the city all the time, and perhaps probably more than that. But so if you missed the first round, we'll get you the second round, and we will set up a calendar and get that out there, dates and locations, and there will be some flexibility in that. But we are open now, so if you're interested, if you're thinking about it, enroll now. Let's get you started with the first group. But if you can't make the first group, we can still take information now and put you into the second group. But whatever you
Okay.
do, yeah, make a move, right? So let us know that you're out there.
Okay. And so how would our families register? I see the phone numbers and the tick on the bottom. Would it be best to call? Is there a link or
Yeah, so I think right now at the beginning it's best to call it text until we get some other ways to communicate set up, and we'll call you back, set up an appointment time and get information. But I think that's easier than going to the website or trying to call the main number. So call the numbers on the bottom of your screen if you're interested. We'll give you a little more information and take your information, and we'll set up some intake time with you.
okay. Thank you for sharing all this information. It's been exciting and refreshing. Does Jesse Trice have Jesse Trice Community Health System have any activities coming up, or any events that we should look out for, the community should look out for?
So we do farm share. I think it's we do one in Miami Gardens. We do one at our Team of Zafar Center in Liberty City. I think it's the third Friday of the month. But we'll put that up on the calendar. But that's always important. So if you're interested or if you're in need of food, we do the farm share. Also, we have a couple of new programs that are coming in. One of our programs is to help with opioid addiction. So that should be up and running in about another month or so. So if there's anybody out there that has family or friends that need help with opioids, you can call my number or call the Just Trice main number. But we're trying to do more with that because we see that's a big need in our community.
Awesome. And do you have any call to action or final thoughts you would like to share with our families?
I just think that we need to go and get help where help is available. I don't think we are struggling because of lack of resources. I think sometimes we struggle because we don't know where to go to get the right thing. So we're really trying to put it out there that if you're in need of help, if it is for parenting, if it's for behavioral health, if it's for primary care, that you should be calling Jessie Trice, another community organization, but you shouldn't be without. So I'm hoping that we can knock down some of the barriers that stand between your need and services that are on the other side of that need.
Okay. Awesome. Dr. Tyler, thank you again so much for joining us today. Those who are either viewing live or watching the recording, thank you so much for joining us as well. Let us know what your takeaways were from today's discussion. Again, if you're interested in the program, the numbers are in the phone numbers are in the ticker. Feel free to call either number. The first one is Dr. Tyler's number. Also, share your thoughts in the comments. Also, let us know what breastfeeding or adjacent topics that you'd like to hear talked about, or guests that you'd like to see join on the breastfeeding masterclass. Also, join us for our in-person and virtual breastfeeding cafe support group hosted by Jessie Trice and Miami-Dade WIC program. We're hosting one this evening at 5:30 p.m. at Jessie Trice Barbara Jordan Center in Miami Gardens. And yeah, and also check out our link tree at JT Breastfeeding for support group registration, any information on other family centered breastfeeding events, and lactations resources. Follow Live Healthy Miami Gardens here on Facebook and YouTube, where we go live. We typically go live with our weekly wellness series every Tuesday at 3 p.m., including our breastfeeding masterclass every first Tuesday at the same time. If nothing else, we have plethora of recordings from topics of nutrition, breastfeeding, physical activity, COVID-19 updates, the whole nine. Um, we're also on Instagram, Twitter, and at www.livehealthymimigardens.com, offering more health content and resources. Thank you for tuning in. Whether joining live or viewing after. Dr. Tyler, one more time, thank you again. And have a great rest of your day, week, and live healthy. Thank you.
Thank you.